Hello, I'm Bethany, creator of the home care agency Startup Academy. I'm so excited to be here with you. I have been a family caregiver for over 20 years, and I started my own home care agency, started the process in 2009, became licensed, and really started taking on my first clients in 2011. So a little bit of a gap there, mainly because of the process, the overwhelm of it all, not having access to information, and honestly, having to reinvent the wheel. And so that is the main reason why I started the Home Care Agency Startup Academy, because there are so many people like you who want to start an agency, who have thought of it, or maybe have started putting some of the pieces together, but then got overwhelmed and had to put it away. There's so many people like you that we need in this field. This field is booming and growing every single day. I have currently a waiting list of clients, people that need help, and the need for more home care agencies is there. I also feel that yes, it is a business, and yes, we need to make sure that we're checking all those boxes, but this is home care, this is people, and so there is a heart-centered approach that I like to teach with. For this series that we're going to get into right now, we are going to be, over the next several weeks, looking at state requirements, your state requirements for starting your home care agency. And I will be putting in the description all of the links that you need as it pertains to the states that we're talking about. And so you can have access to those to research further with those. We're going to start right at the top, right at the beginning with the A's. So today we're going to be discussing Alabama, Alaska, Arizona, and Arkansas. All right, so let's go ahead and get started. So Alabama actually doesn't require a state license for non-medical home care agencies. However, you still do need to comply with federal and state regulations. So this would include obtaining a business license, of course, registering with the IRS, and then following labor and tax laws. Also, to start your home care business in Alabama, you're going to need to have a tangible address. So this means not a P.O. box. It needs to be a physical address. You need to have your EIN, your employer identification number, if you're going to be hiring people to work for you. Now, when I first got started, it was just me, and I wasn't contracting with Medicaid yet. And so I was operating as a sole proprietor using just my social security number. And I am not a tax accountant. I am not giving legal or tax advice here at all. I'm just sharing my experience and how I started. So I did that, and then I switched over to an employer identification number shortly thereafter, because it is better when it comes to taxes and not getting taxed so much. So you can, maybe a couple avenues, talk to your tax accountant or tax expert. What would be best for you as far as getting started? Would it be a sole proprietorship, or should you go more with like an LLC and have that employer identification number? Get a state tax permit from the Secretary of State's office. And once you do start thinking about taking on Medicaid clients, you are going to need that MPI number, your National Provider ID number. So that way there you can bill Medicaid. And then, of course, other considerations are training and accreditation, developing your business operations, and marketing. Okay, so that is for Alabama. let's look at Alaska. So Alaska, I had to do a little digging on this, but I found it. Alaska has what they call personal care services. And you do have to fill out an application to become certified with the state of Alaska. So it is 9 pages long, and I will share all of this with you. They want things like, I'm just going to give you a brief overview, and then if you live in Alaska thinking about starting your home care agency, I would definitely reference the link that I share. All right, so they want policy and procedure. They want to have an example of your policies and procedures. They want a business license, and that's something that you do on the state level. You obtain that. They want certificate of insurance, so they want to see proof that you're insured. They want to have an organizational chart, okay? They want a personnel list. They want to know about the program administrator, and well, that's for renewal applications. Okay, they want background check, policy, and procedure. So a lot of your states, what we're going to see, and this is a good thing, they want you to do background checks on the caregivers that you're hiring to go into these homes. And this is a good thing. We want to do these. Actually, in my state, in Maine, we have to do it through the state of Maine's website, and it is a comprehensive background check. Like, it goes through layers of things. It is not just a simple little check. It's a lot going on, and we are actually required to update that every year. Every year we have to be, even on our current staff, we have to run a check in case something transpired, because our rules and regulations are very, very detailed in the hiring process, and if someone has a certain level crime, we're not allowed to hire them. So we have to have this updated background check every year in my state. But that's my state. We're in Alaska right now. We're talking about Alaska. Okay. So you have to have your incident reporting policy and procedure. They want to see that. Accountability, financial accountability policy and procedure, quality improvement, restrictive intervention policy and procedure, training policy and procedure. So there's quite a few things that the state of Alaska wants to see before they will give you this certificate to start working. And under each of those that I just spoke on, each of those items, they do break it down into examples of exactly what they want to see. So that's really nice. It really gives you some guidelines. It's a lot of work. It's a lot of work to create all of these. It is, and it can be fun. It can be good, but it also can be overwhelming, and it also can it can slow you down a little bit at times, because there's so much with it. But not to worry. That's why we're here together. We have the solution to all of this. Okay, so that's what you need in Alaska. Let's look at now Arizona. So in Arizona, you do not need a license for a non-medical home care business. Kind of similar to Alabama, where you do need to have that state tax ID number, your EIN number, the MPI number for Medicaid purposes, tangible address, and a state tax permit from the Secretary of State's office. In Arizona, they're also going to require you to have a statement of information and Secretary of State formation. So I would dig a little bit further into that and call your Secretary of State and get clarification on what exactly that means. If it's just like this little statement about your business and who you are, who you're going to serve, what your services are going to be, or what they're looking for there. There is no details here, and I apologize for that, but something to check in if you're in Arizona. Now, Arkansas, let me get over here to this. So this took a little digging as well, but I did find a form that I will share with you. And it is 23 pages long. It's rules for private care agencies in Arkansas. So it goes through all of it. All of their rules are here that you can read. And I'm just trying to scroll. Of course, it goes over some definitions and about what they want for as far as insurances go. Agency location. So this is so interesting to me because, again, it all varies state to state. So in Arkansas, a private care agency shall maintain a licensed, fully operational primary office physically located within the state of Arkansas, and a sufficient number of licensed regional offices to adequately service the administrative needs of the agency and the clients. So they want you to have a physical office in Arkansas. Now, what that doesn't say, and where that gets gray, and this is what was interesting to me, is I can have a physical office that's attached to my home here in Maine, and that's okay, or a home office, and that's okay. Some states, and see, this isn't clear to me, I would have to get clarification on this, say no home office. You have got to have a office that is in a professional building, it's a commercial space, etc. So definitely when you're reading through these, keep that, just make notes, right? Write down your questions, and so then when you call your state, you have everything right there and get all your questions answered at once. Okay, so they have an application for your license that you have to fill out. Training they want to do training. It's going to be supervised by a registered nurse, be a minimum of 40 hours to include classroom and clinical instruction. Have written course objectives, expected outcomes, and methods. Unless the agency has been properly authorized by the Department of Higher Education to operate a school, training shall be limited to agency employees. So they want you to be offering some training in Arkansas as well, is what it sounds like to me by reading these briefly. If you are not a nurse and you are starting this, and it doesn't look like you have to be a nurse to get started in Arkansas, not from what I'm seeing, you can hire a nurse to come and work at your company. They could work as a subcontractor. That would be more beneficial tax-wise to you and to them. Again, not a tax accountant, just sharing from experience. I've done this. I'm not an RN. I did do some RN school, but it just wasn't for me at the time. So I've hired an RN to come in and do trainings for my staff, and that meets our requirements. So no need to worry about that as far as being an RN or not. Of course, Arkansas wants to see some policy and procedures, organizational policy that shows ownership and structure, infection control program, personnel records, job descriptions that you have the employee sign in Arkansas, qualifications, education, or training. They want a quality assurance program to ensure that the client is satisfied, and you can do that through surveys. Supervision of services, that's very common requirement. They want to know how you're going to handle complaints and incidents. And then They want you to have a governing board in Arkansas. It says a private care agency shall have an organized governing board consisting of at least one member, which may be the owner, who shall be legally responsible for maintaining quality client services, establishing policies for the agency, shall be legally responsible for the conduct of the agency, and shall establish a mechanism to adopt periodic review written bylaws or acceptable equivalent, approve written policies and procedures related to safe, adequate services and operation of the agency. So they have quite a few things here in Arkansas, but that's okay. That's all right. And personally, hearing policy and procedure, it's kind of heavy, but I absolutely love writing policy and procedures now that I've been in this for over a decade. I love it. I think that it definitely serves a purpose. I like the wording of it all, and yeah, it's all good. Right. Then they want to know about your records, like your care plan. They want to know about tests that are completed. Yeah, so there's a lot here with Arkansas with all their rules, but it's okay. Like I said, it's totally doable. It's very comprehensive, so that is good. That is a good thing. So that concludes this round of requirements to get licensed or certified in your state. And next time we will be starting with California. We're just going right in order. So thanks for watching, and let me know if you have any questions. Take care.